All right, thank you. Kind of feel like if I was at a country concert and we decided to have the headliner go first, and then secondary act followed up, but we'll try and do a good job tonight. Tonight we're going to talk about the second half of it, continuing from last month. Last month we talked about lower extremity injuries. Today we're going to talk about upper extremity. So just a couple of stats on upper extremity. There's about 200,000 rotator cuff surgeries a year and over 400,000 different surgeries for tendonitis and additional tears. 110,000 lost time hand injuries a year here in the U.S. and over 1 million workers go to the emergency room each year with upper extremity injuries. And there are 230,000 carpal tunnel surgeries a year. So some of the most common surgeries that we see. Tonight we're going to start out just like last time, what controls the arms, and we'll be bringing up one of the models. Very important, I always think whenever someone comes in with any kind of injury, with the exception of, boy, we know it's what's called a fouche injuries. They fell right on their hand and we know it's directly that, or direct trauma to the elbow or to the shoulder. I always like to think what's going on with the upper back and neck, because if you look at the upper back and neck, that's what actually controls the hands, arms, shoulders. So we'll focus a lot for the start of this on the upper back and neck. So one of the things that we see more and more when I was in grad school, we called it military neck. So when you look at the spine, and we've talked about this before, the spine should have a curve in it when we look at it from the side. This starts with babies and why we want babies to crawl as much as possible. So when you look at a baby, when they start out and they develop, they're born in a C-shaped curve. As they start to go tummy time, they lift up their head and they start to crawl. That's what develops these secondary curves, the lower back and the neck. It's our job then to enhance them and keep them there for the rest of our life. But what do we do with babies? We put them in bumbos, and then we put them in those jumpers, and then we put them in containers, the shoes on their feet, and then we give them things like a phone or an iPad starting at age as early as 5, 6, 7. So their neck, not only are they losing the curve and that straightening, it's actually reversing. And if you look closely here, especially at the end here, when my neck is put way forward, I can put as much as 60 pounds of pressure on the back of the neck. So if I take a head that weighs, say, 15 pounds and I put 16 pounds or 60 pounds back here, well, eventually, just like if I lifted my bicep every day, I'd get a bigger bicep. Well, your body will start laying down more and more tissue down and through here. And there's a couple of conditions endocrine-wise that can cause that, what we call a Dowelling Hump. But you can also get some tightness on the base of the neck just from a head that's too far forward. If that stays too far forward for too long and I start to put more pressure on these little spacers between the vertebrae, I can actually end up with what's called degenerative disc disease. So if we take a look at a healthy spine and abnormal, and this is where always, when I get patients say, well, I was told it was due to old age, I'll usually come back with, well, what about these two discs up here that look like they're healthy? Did you get new discs put in? No, they're all the same age. So it's a loss of function, not just about time. Here's another phase. We used to grade these in phases. So this would be a normal, healthy neck, C-shaped curve. Eventually we lose it, what we call military neck. And eventually over time, you see little man, little lady. Well, I joke around, I'm almost 40. We're going to see a literal 50-year-old probably within 10 years here. I thought this was a really cool image just to show you all the nerve roots that come out of the neck and that go down into the arms. And this is where sometimes I can get a pinching in the neck and it can refer elsewhere. Probably one of the most common referred pains that we've heard of. I liken it to the analogy, if I step on a dog's tail and it barks, do I take pressure off the tail or do I treat the bark? Well, we've all heard of someone having a heart attack, and sometimes guys will have that pain that goes down the arm. Well, the problem isn't the arm, it's actually coming from an organ, it's coming from the heart. Well, at the same thing at the base of the neck, you can pinch a nerve here and it might not hurt at all, but it might hurt down into these fingers, and then we call it carpal tunnel. So carpal tunnel syndrome, we sometimes like to call it a double crush phenomenon. Yeah, it may be getting pinched in the carpal tunnel, maybe getting pinched under a muscle here under the clavicle, or one of 5 spots here. I also like this one where they put in the musculature here, and this is where sometimes we'll see If I have a patient with a head that's going too far forward, it may be coming pain into the arm, coming from the base of the neck. What about one of these tight muscles? They're called scalene muscles. This right here is called your pec minor muscle. So in this, what happens if I get really tight rolled in shoulders, I've had poor posture, these muscles get tight. And then if I sleep with my arm under the pillow where I cut off that space, my subclavian artery and vein, that's where people come in and say, boy, I always get numb and tingly hands when I go to sleep at night or when I wake up in the middle of the night. I joke around and I'll say, so what causes pain when I do this? Okay, that'll be $100, don't do that. So thoracic outlet syndrome is another thing you've probably heard the term before, but basically I can cut off the vasculature, the subclavian artery or vein, or I can cut off this brachial plexus. And you can see here the clavicle, the muscles, and then this pec minor that goes right through here. Eventually I can start to have hand pain, and Dr. Matt will actually be going over some of the common injuries with the hands and how to rehab it. Basically I have 27 bones in the hand, and then I have 2 bones in my forearm, my radius and ulna. Radius actually turns over. If I look at the elbow is just a simple hinge joint. Sometimes we'll see this. If you look on, so outside this we'll see start of the year when people start doing outside work. So if I use my wrist extensors right where they connect into the bone here, if that gets irritated, I can irritate that tendon. It can become inflamed. I go to the doctor, they call it tendinitis. Itis means inflammation. Sometimes they call that tennis elbow, doing a backhand. On the opposite, you can get golfer's elbow if that tendon gets a little bit sore or inflamed. The anatomy of the shoulder, you have 4 main muscles that comprise the rotator cuff. It basically forms a cuff around that, basically to help hold the shoulder in. So I hit some golf balls earlier today. I think of a shoulder like a golf ball on a golf tee. It's not like the hip that's in there deep. That shoulder can actually come basically out of it. I've replaced a couple of dislocated shoulders back in the day. Actually teaching in Boy Scouts some things that you can do, pull down on the arm and get it to suck back in. But if these muscles right here where they insert into the arm, if they start to get injured, or if I've had bad posture, wear and tear, eventually that's where you can get a rotator cuff injury. They do 4 specific motions, or basically I have this one right here, one of the most common, the supraspinatus muscle. It goes on top of the spine and scapula. Its job is to what's called abduct the shoulder. I have 2 muscles that help pull the arm back. That's my infraspinatus teres minor. And then I have one, I think of the Sylvester Stallone Over the Top movie, subscapularis. So, any of you taking an anatomy exam tomorrow, hopefully I helped you out. So just like last time, prevention, is your body ready for activity, proper diet, nutrition, warmed up, static stretching versus dynamic stretching. So what are some of the things I can do to avoid upper extremity injuries? Hopefully from the first few slides I went through, I think of a lot of it starts with the upper back and neck. And I'm going to try to prove this a little bit. If I put my head forward like this, and when you look at me from the side, my ear, shoulder, hip, and ankle should all be in a line. Well, if you're at home right now and you stand like this, try and raise up your arms. It becomes a lot more difficult. If I go like this, it becomes a lot easier. So what happens if I have posture like this for 20 or 30 years? You think eventually I'm going to have some shoulder issues? So a lot of different extremity issues start with the upper back and neck. A couple things I went over last time. I got a better slide, a little bit more clear. This is where it kind of gets confusing. Eggs are good, eggs are bad, eggs are good again. As far as even what we're supposed to do with injuries, well, heat or ice, kind of like tonight, you have a pretty popular sporting event going on, the NBA Finals. And so if they get injured, multi-million-dollar athletes, or if you play for the Packers, they're generally going to use ice packs, ice tubs, ice baths. They generally don't use heat. And I always joke around, there's very little research for either, so I guess doctors aren't going to be wrong if one says heat and one says ice. We're always going to err on the side of what do we do with multi-million-dollar athletes. We use primarily price. So protect, rest, ice, compress, elevate. It's gone on to police, peace, and love. I still keep coming back to rice and price. This I thought was a really neat slide that kind of showed that. So let's say I injure a joint, I sprain a hand, I sprain a shoulder. I'm going to use price. I'm going to use cryokinetic ice bath, myofascial release. I'm going to start to get some motion, as Dr. Bouch had talked about a couple of those athletes. Kind of funny, I remember Kurt Warner, the quarterback, when I was in school, but I also had a picture of Kurt Warner, the running back. I always thought it was kind of cool. I'm like, oh, here's another guy, and I never knew the story until Dr. Bouch told me. Mobilize. And if you think back, even for backs, if you go back into the 30s, 40s, 50s, you hurt your back, what do they say? Oh, let's put you up in traction, let's rest you. It's like the worst thing ever. I think of even what they did with JFK with his back injury. His doctor was like, no, we got to get you moving. And if you look at some of the famous pictures of JFK, he's in a rocking chair. So the moment I can mobilize, the better. Generally, we're going to say anything that doesn't cause a sharp pain. So as long as you're not getting super sore or getting a sharp pain, that's good mobilization. How long does it take to heal an upper extremity issue? Well, pain can disappear relatively shortly. A couple examples: only 10 to 18% of your nerves control pain, kind of like those patients I see with tons of arthritis. Well, it just started hurting last week. No, by the time you get degeneration, you're talking decades of an injury. High blood sugar, cholesterol, arthritis, heart disease rarely cause pain until years later. Healing of ligaments and tendons can take weeks to years. Okay, I'd put this up last time. Stages of wound healing. We have an injury, we get bleeding right away, and then inflammation, usually 72 hours to 6 days. Proliferation, and then remodeling, and even on here, it says up to 2 years. I always think of the repair phase 6 to 8 weeks. Those are typically patients that first come in. If you see us or a physical therapist, that's typically what we start out with, that 6 to 8 week. But to completely remodel it here and heal it, months to years. And then this just goes a little bit more into the stages of soft tissue healing. I taught a course for the state here a couple years ago. We never talk about stage 4 though, lifelong contracture of scar tissue. So once you injure a joint, you're probably going to be working on it for the rest of your life. Kind of like if I'm a type 1 diabetic, I have to maintain and watch my blood sugar throughout the rest of my life. I use my left shoulder as an example. I've hurt this twice in practice, probably done close to 100,000 adjustments in my career now. When I start to get really tight, if I put my arms back like this, even though I get adjusted once a week for maintenance, I still have to go in and see a massage therapist periodically, because if this gets tight, it means, oh boy, I might be getting some adhesion scar tissue, and she goes in there and breaks it up for me. Some nutritional support. So I always kind of go back to those 4 essentials, meaning what your body can't take or what your body can't make, you need to take them in. Vitamins, minerals, amino acids, fatty acids. Eat real food and avoid carbonated beverages. Really simple, easy things. So even when you look at all the different supplements, things that we use, a lot of it comes back to what am I doing every day? If I have a perfect diet where I eat raw, organic, wild caught, fish and game and that, and I'm getting everything perfectly that I need, I'm moving, I have low stress, yeah, I probably don't need a supplement, but if I'm an American, I probably do. Here's some of the acute support that we had mentioned last time. Dr. Lexi did a good job explaining a little bit about them, but right away you get hurt in that repair phase. We might use these for at least the first 6 weeks, Ligaplex and Vascuzyme. Our long-term support is Ligaplex 2 and Collagen. And I just want to touch a little bit more on collagen. Some of the most popular supplements online in the past few years have included collagen. So what is it? There are 28 types of collagen. 7 are important to human health. 90% are type 1, 2, and 3, primarily type 1. So what do those do? So why collagen is one of the most popular supplements online right now? A lot of it has to do with type 1. It's good for your hair, skin, and nails. And why do we take things? So we look pretty. But it's also good, like type 2, for especially the discs in the spine. Type 3 is going to be more around the organs and some of the soft tissue internally. So this picture kind of illustrates it a little bit more. So you'll see type 2 collagen, the knee, the disc. Type 3 around the gut. Type 1, hair, skin, and nails. Kind of interesting, when you're repairing blood vessels and that, you just get an injury, you get a scar, you'll have type 3 collagen. That has to remodel into type 1 eventually. And part of that involves motion. So the more you can get motion into a injured joint right away, the better. Kind of like if I have whiplash in my upper back and neck from a car accident, I might feel better after a couple weeks. But if I have a joint that's been stuck and isn't moving, or I have scar tissue around the muscle, the quicker I can get that moving, the stronger that collagen is going to be for a lifetime. Just a couple of the different points of collagen. So if a person says, well, do I have to take collagen? How can I make it? Because your body can actually make collagen. Well, you need 3 different amino acids. You need glycine, proline, and hydroxyproline are the main amino acids that make it up. You need vitamin C, zinc, and copper. So unless you're eating foods with that, and I put this up, so if you look at, some of these mean essential. We need to have 9 essential amino acids, actually out of these histidine more so for kids, but basically these bottom 8, that's what we need in our diet every day. In fact, when I'm not eating as healthy, I'll actually take a pea protein, which is just missing or a little low in methionine, and that's how I get my amino acids if I'm not eating perfect. But if you look at these other ones, like glycine, it's conditionally non-essential. Let's say I'm having just a ton of stress and I'm not eating healthy, things like that. Sometimes I actually need to add that into the diet. It's almost like it's an essential nutrient. In fact, I take something like glycine right before bed, especially magnesium glycinate. Magnesium and glycinate can help those with sleeping issues. We'll probably end up doing a talk we've talked about on sleep health here in the future. As far as rehab goes, I'm going to turn it over. I made my slide before Dr. Bouch told me today that he's going first, so I'm going to have Dr. Matt take over. So Dr. Matt will be right up.